Hello, welcome to the Smarter Meds video blog. Today I want to talk about Serotonin Syndrome, which is a potentially life-threatening condition that's basically a drug reaction caused by taking multiple medications that act on the neurotransmitter serotonin. So I want to talk a little bit about what it is, what the signs and symptoms are, which medications have been implicated, and who's at the highest risk for getting this syndrome. Now, serotonin syndrome is very rare, and it hardly ever occurs when you're using just one medication that can cause it. But it becomes more common as you add more medications to the mix that increase serotonin activity. Now, it can be a life-threatening situation, so it's very important that you identify if you're at risk for it, and that you know how to identify signs and symptoms so you can notify your doctor immediately if you believe it might be occurring. Serotonin syndrome is usually classified with a couple different disorders. And the first is going to be musculoskeletal disorders, which commonly present as muscular rigidity, kind of rigid movements, uncontrollable muscle movements, and even arresting tremors sometimes, uncontrollable, shaking. Those can be a big clue. Also, we see some mental status changes, so if you become confused, any hallucinations, or even agitation, these can all be signs of serotonin syndrome as well. And the last and usually most severe presentation is going to be an autonomic disorder. That's usually kind of a hyperactive response of the body. You might get some increased temperatures. In fact, often when serotonin syndrome is fatal, it's due to very severe fevers. There's been reports of fevers up to 107 degrees and above. Also diarrhea, sweating. These are also common presentations as well. Medications that can usually cause this are, for one, antidepressants. Most antidepressants increase serotonin activity. So those are usually the base of the cause of serotonin syndrome. So when you start adding multiple medications in the mix, that's when you start to see it. And a lot of people don't think about other medications that can cause increased serotonin as well that are outside of the antidepressant class. And this can be some pain medications like methadone or tramadol or pentazocine. It includes muscle relaxants like Flexeril, medications like Buspar, and medications used to treat acute migraines, the triptans, which includes Imitrex and Maxalt, and other drugs in that class as well. Even an over-the-counter product, an herbal product called St. John's wort, can increase serotonin levels and increase the risk of developing the syndrome. And lastly, not only medications that increase serotonin activity, but medications that inhibit the metabolism of medications that increase serotonin activity can increase the risk as well. So this is why it's so important to always screen for drug interactions when you're taking multiple medications. The list is too big to give right here on this video blog, so if you check out our Facebook page, when I do get around to putting this on our Facebook page, I'll include a list of all the medications that have been implicated so you can review it and see if any of the medications that you are on could be putting you at risk. So people that are at the highest risk for serotonin syndrome are those that take multiple medications that increase serotonin activity. The more medications you're on, the higher the risk is. And also people that have organ failures. And when I say organ failure, I mean kidney disease or liver disease, because these people tend to get rid of drugs more slowly and the drug can accumulate. So if you have a serotonergic drug that's accumulating in your body, the serotonin activity is going to be higher. So you're going to be a much higher risk for developing the syndrome. So I hope that's enough information to at least get you a little bit informed. And like I said, check out our Facebook page. I'll post some materials that will help educate you a little bit more. And make sure that you're always asking your doctor and your pharmacist to screen for these things whenever they're starting you on a new medication, especially a new medication that has any kind of effects on your central nervous system, like an antidepressant, a pain medication, and even antibiotics. Even the drug Zybox has been implicated in causing serotonin syndrome. So, like I said, it can be a very serious problem, even though it is rare. When it does occur, it can be life-threatening. So, any questions, feel free to hit us up on Twitter or Facebook. And until then, stay tuned for our next video blog.